What am I? You gonna be a cynic? I don't wanna be a cynic. I wanna be-
3 of mine is mine, so,
Oh, okay.
All right, so
I
you,
mean, yeah,
if they have questions.
yeah, so we'll keep it moving for you.
Perfect.
I like that.
Hi.
Nikki,
Good morning.
how's that beautiful child of yours?
She's so wonderful.
Paisley, right?
Paisley, yes. 3 weeks and she's gonna be a year old.
No way.
Yeah,
Oh my God.
I know.
Roxanne taking charge, there you go.
Ash takes a while.
Great things out there.
I'm sure that's not in the training.
No, what we're gonna do is we're not gonna live stream today. We're gonna
Good.
see if there's people that respond.
Kelly sent you over that.
We're live.
Very good. Thank you.
There he is. Yeah, right now. Just came up.
I just wanted to see how many people would call and say, hey, we didn't see you.
At least 2.
Yeah. They'd be all employees of the county.
Yeah,
Oh, that's fine.
there's a lot of them that watch.
I know.
Got alcohol in it probably, right? That's a good thing. With a small agenda, good thing we're not scheduled for.
Yes, we spoke about that.
Yeah, 'cause we need
during
to
our
go.
public
We need to be out of here by 10:40
When?
today.
hearing.
Because we're over at the repertory meeting today.
Isn't that incredible?
I don't think it's on any of your calendars.
Is it?
That's what I was like,
What's
what are you
that?
talking about?
I was gonna be reading those health proposals. At the repertoire.
I just heard about it this morning.
What proposals?
We have a healthcare meeting this afternoon.
Yes, afternoon.
That's
One at
later.
3.
Yeah,
There are 2 broker books that are.
yeah, 2 of them.
Explain what
Do we
the
have anyone on the
proposal-
line?
Oh, okay, well, I guess I was aware of it only because temptation. Huh? Yeah,
Is there anyone on the line?
today to sign the bond. That's what it's about.
Yeah, I think you gotta call them.
And then I thought I'd
Yeah,
just
I
go over
think
and
they
say
hung up
something
to
to
him.
him.
Hello?
I didn't know it wasn't on you
I'm gonna
guys.
blame Tony. He's
Yeah.
not listening.
It's okay, I mean, I really wanna go through these.
What's that now?
Did they already get- Did you, were you working on them for last month?
Last night I was up till 3 in the morning reading.
You should have been doing your training till 3 in the morning.
Oh my God, I gotta do my training when I come back.
Hour a week.
You need 4 hours a day to do the training.
No.
Even uninterrupted.
Yeah.
You guys,
Each one takes about 45 minutes. to an
you
hour.
guys
Did you
just
see the
don't
new
care.
personnel request? Did you see the print?
Mhm.
$750,000. Between training
We're ready now?
Ready?
Ready.
Yeah.
and.
Morning, everyone. Ask you to please rise for the opening prayer and pledge of allegiance. Dear loving God, we come to you as a nation with heavy hearts. We are a country that is divided. We need healing and unity at this time. We are reminded of a quote by John Kennedy. We all breathe the same air. In a song from our childhoods, we recall that you love the little children of the world. Red, yellow, black, and white. They are all precious in your sight. Let us resemble the same vision and make everyone precious in our sight. Father, we thank you for the much needed rain today. We pray for our farmers, the crops, and the livestock. We ask you to grant us wisdom as we conduct the business of the county. We pray that we always look to you for our wisdom. We know that you are all that is truth, knowledge, and wisdom, and that comes through you. We pray these things in your name. Amen.
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. We'll convene the Commissioners' public meeting at this time and ask for a vote on the minutes of the previous meeting.
I'll move to approve.
I'll second.
All in favor, say aye.
Aye.
And then we'll ask for public comment on agenda items only at this time. Hearing none, move on.
Nikki Godshall, accounts payable cash requirements report.
Good morning, Commissioners.
Morning, Nikki.
The cash requirement report for this week is $2.2 million. Did you have any questions on it?
I don't. Either one of you?
Interestingly enough, the hotel tax for July was almost 100,000, which is somewhat close to what it would be under normal circumstances.
There'll be a lot of activity.
Yeah, a lot of activity, 1.2 million or so. Interesting.
Okay, I have a motion to accept.
I'll move.
I'll second.
All in favor, say aye.
Aye.
Aye. So carried. Thank you, Nikki.
Thank you.
Personnel actions, Roxanne Greco.
Good morning, Commissioners.
Morning, Roxanne.
At the prison, we have Cody A. Hess as a full-time replacement correctional officer relief, pay grade CO1, $17.23 an hour, effective October 11th, 2020. Also at the prison, we have Acacia J. Robatas, full-time replacement female correctional officer relief, pay grade CO1, $17.23 hourly, effective October 11th, 2020. I'll take those two first and then do the
Okay.
report.
Again, these are replacement jobs for correctional guards over at the prison.
Correct.
Any discussion on either position? Hearing none, can I have a motion?
I'll move to accept and approve.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
Moving on to 3.3, this is our monthly report of personnel actions for the month of September 2020.
Any discussion on those? Have a motion to accept.
I'll move to approve.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
Thank you.
Thank you.
Maya Toon is unable to attend the meeting today. Director McDermott was going to present for her. And there's an informational item.
They're just gonna announce the RFP for the installation of the kitchen hood fire suppression system out at PRC. I think we're all aware of the challenges that we've had with that.
Okay.
Action items,
Thank you,
5.1.
Matt. I'm sorry. Go ahead.
Sorry, go ahead.
Yep.
Jerry Kennedy, vote on renewal purchase for network monitoring services.
Morning, Jerry.
Morning, Commissioners. What you have before you is a $10,680 renewal for our MSISAC network monitoring and security alerting service. This is something that we are able to utilize as a government entity. This is, the MSISAC is a division of the Department of Homeland Security, and they are doing this at a much reduced cost. If we were to do this commercially, we'd be spending $60,000, $80,000, $100,000 for the service.
Okay. Any questions or discussion? Hearing none, can I have a motion?
I'll move to approve.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried. Thank
5.2, Lauren Strasser. Lauren, are you on the line?
Yeah, I'm here.
Okay. Go ahead.
Good morning. I'm requesting approval for the 2019-904 Recycling Performance Grant. The total tonnage for this year is 15,050 tons, 0.4. And this is an annual DP grant for the county's recycled tonnages for the year, and that would be for 2019.
Okay. Any discussion or questions?
Lauren, this is down, I take it, the tonnage?
Yes, actually, the tonnage is down, and I looked back, and it is mainly because of the office paper has decreased from last year. And that's not on our end of what we've been receiving, that is from what we get reported by businesses. So businesses will send us their recycling report, and if it doesn't come to us, we have to put that on the application because it's been recycled within Lycoming County. And this year, it went from over 800 tons for our office paper down to 81.
Wow.
So that could just be people doing more electronically. It could be people not reporting what they had, or it could be a lot of different methods. Even just one company no longer providing that.
What was the time period? Was it 2019 or was it a month to calendar year 2019? So it doesn't have anything to do with COVID-19.
No, not at this time. We'll see a difference for next year's report.
Yeah. Maybe people are just trying not to print as much and they're using more computer. We know even in our...
You know, it could very well be that the businesses aren't reporting. Because again, this would be the tonnages that's reported to us. It's not what we had or having come into our facility.
Okay.
Okay, any questions or discussion, further discussion?
Well, when tonnage is down, we get less money in our grant, right?
Right, and this grant is only for paper products, the metal, the aluminum and steel, the glass, and plastic, PET, which is number 1, number 2, plastic, and some mixed rigid plastic, as well as single stream. But we do not have reimbursement for electronics or wood or tires or anything like that.
Okay, a motion.
I'll move to apply for the grant, or accept the grant.
I'll second.
All in favor, say aye.
Aye.
Lauren, before you go, I just want to note that we're very pleased that the city police have made two arrests actually, for the dumping at the 3rd Street recycling. We've been working with the city police on this, and they were able to apprehend 2 people and arrest them for some of the illegal dumping. And we want to compliment the city police for working with the county. And we'll continue to prosecute people who illegally dump at our sites because we want to make sure they're there for the majority of the people that are doing it right. And just wanted to note that while you were on the phone because you're in charge of the recycling over there.
Yep, and yep, and hopefully people continue to use it properly and don't ruin this opportunity for people that are doing it correctly.
Yep, thank you. Have a good day.
Yep.
Yep.
5.3, Jeff Hutchins, voting on declaration of disaster emergency.
Morning, Commissioners.
Morning.
Our current disaster declaration expires tomorrow. I'm looking for a new one, another 90-day declaration for the coronavirus pandemic.
And that allows us to continue to apply for the federal funding.
The funding, emergency purchases, as we push through some other resolutions, yes, keeps those lines open.
Okay, thank you. Any discussion?
It's for 90 days?
Yes.
Yes, sir.
Yep. A motion to accept.
Yeah,
sorry,
I'll
go
move
ahead.
I'll move to approve it. A quick question for you. I noticed on one of the websites, you know, we have the state reporting the number of deaths one way, the county coroner reporting them another way. And so I think I had seen 25 deaths.
Yeah, the daily number, the most up-to-date number I sent you yesterday was 25. I'm pulling it off the health.pa.gov website.
Right.
Now, off the hook, that's the information's only as good as hospitals, medical centers are reporting into the Department of Health.
Yeah. What about, have you seen a lot of reporting of cases? Yesterday a constituent called me and said that there had been an outbreak at Muncie Skilled Nursing Center. I haven't been involved on the last couple of phone calls on the COVID. So there's a number you can call. I didn't get a chance to call it, but I was wondering if you had heard about that.
I have not, honestly, this week, I have not looked at also on that website, you can go to the extended care nursing homes and everything, and see that data. I have not looked at it yesterday or today yet.
Okay, all right, I'll check it, thanks.
But it's right
Thanks
on
a
that
lot.
health.pa.
Yep.
I'll look as well and let you know what I find.
Okay, they don't typically report to you though?
No, I just go to the Department of Health website, yeah.
Yeah, because by law, they're reporting to the Department of Health.
Correct.
Yep, okay.
Now, we do receive the information for the first responders. I will see a refresh of that tomorrow morning.
Okay.
And Commissioner, when you look at the State Health Department site, it doesn't give you an identification of where it is. It just says nursing homes, assisted living facilities.
Oh, it doesn't go by,
Gives you an aggregate.
okay.
Actually, there is a breakdown.
There is a break.
Yeah,
Different.
by nursing home. You have to dig a little bit, but it's there.
On the main one.
What about, is there a breakdown by colleges?
No.
No.
Okay, so for example, this morning a constituent texted me and said that she had understood that there had been since July 51 confirmed cases among students at Penn College, 5 cases among staff. But I haven't really heard or seen anything, and is the state tracking it? I guess my question is the state tracking it in areas where people congregate? We always, you hear the anecdotal story, oh, my cousin went to a party and got it, but more likely transmission occurs in these large gathering places, and I've wondered whether, and I don't even know if it's true, for all I know it may or may not be correct that Penn College had 51 cases, but I think it would help all of us as a community to know because it might encourage us to wear masks more.
Penn College has it on their website.
They do.
A breakdown of students and
Staff, okay,
You have to go to there. It's not through the state.
right.
okay. It's not reported to the state health department doesn't,
They may have it, but it's not being regurgitated back out to us. But the quickest way is, like she said, to go directly to the college.
okay, great, thanks a lot.
And as you send us your reports on hospitalizations and ventilators, I never see it printed in the paper. And maybe we should be sending Mike that. What's the matter?
This whole thing is ludicrous. You go on the state website, it gives you all the information you want. You have to do a little bit of digging, and it's all there. You can go in, put a zip code in, you can find everything you want. You can do whatever you want to with that site. And if we don't have the facts straight, we're in trouble. So we have to get the facts straight, and as far as these deaths go, it's 29 as we speak today. And they're not going down, they're going up. So with all reality to this, again, I don't want to get in a long conversation about this. It's not my turn to speak. All I'm saying to you is, without a plan, we're screwed.
Okay, thank you.
Jeff, one of the reasons I asked is, I just wanted you to refresh my recollection how the difference is between the coroner's calculation of deaths and the state. Because the coroner came in lower or higher?
The coroner's higher. That's where the coroner would agree.
Oh, that's because if they're from out of state, but they die in Pennsylvania.
It's the record. Yeah, it was initially started out with the they thrust all the doctors and everything into using the electronic death record that they'd never used before. So there's discrepancy in how it's being reported into the Department of Health.
Right.
And yes, the coroner in person reports higher than what the state is currently reporting.
Because if you die in Lycoming County, the coroner reports it. If you die in Lycoming County and you're from another state, the Department of Health is recording it in the state that you were from, was that correct?
That has changed. That changes by the day, I think.
Commissioner, I'll give you an example. There's a person that died in a nursing home in Milton.
Uh-huh.
They listed her as a Lycoming County death.
That's correct.
Oh, okay.
Yeah.
But she was a resident of Lycoming County, maybe?
At one point.
At one point,
Yes,
okay.
but they listed her as Lycoming County death, even though she's been down in Milton. in a
The
home.
same thing has happened at Jersey Shore with Manor Care with
Okay.
1 or 2 patients.
Agreed, yes. And especially there was a discrepancy with being so close to the Clinton County line where things are being pushed back and forth. I agree with you.
Okay.
Well, I guess it's
Not at this
alarming
time.
because I when you look at the number of cases we have, continue to have, and I mean, this is hard for me to believe. I understand we passed 200,000. One of the things that we don't want to do is become complacent, because as these numbers grow and we become more normalized to the deaths and so forth, it's very dangerous as a community.
The key is hospitalizations and ventilators. There's one case in the hospital. There's none on ventilators. And they have been low. Even with cases in Lycoming County going up, the hospitalizations have been 8 or below. Today it's 1. The most ventilators I've seen has been up to 3. Today, it's been 0, and that's the key. That's why the state was shut down in the beginning. Hospitalizations and ventilators. We've lost track of that. This is it. This is out there. It's serious, okay? But at the same time, we need to focus on protecting the ones that are vulnerable, because a lot of people are going to get this, and they're going to be asymptomatic.
Right, and that's what brings me back to what happened with Muncie Skilled Nursing Care. The person who called me last night was a constituent whose mother is there. And I think that we may want, in light of the $10.2 million that we received, revisit whether or not we make available to some of the community organizations. She basically said, I want to get my mother out of the nursing home because I'm fearful they, I would rather have, more detailed facts, but that was the long and the short of it. But I guess what I started to say was that the prediction is that we're going to have 400,000 deaths by December. And I hope and pray that isn't the case, but I never thought we would hit 200,000. So I think that's Dr. Fauci's prediction. So anyway, I think we just have to be mindful in our little small community here where it sometimes seems relatively safer, certainly than others, but we need to be mindful of wearing masks. I still go to places, large, places where I don't see people wearing them, and I think we really need to do that. So anyway, that's just, thank you for putting together the extension.
Yeah. And I'll just clarify, we're still waiting on a coronavirus vaccine, but now more than ever, it's important to get your annual, normal, influenza A vaccine, that's going to be coming out soon. So we want to make sure we tell the public that, it's a different strain, but, all your vaccinations are important.
Yeah, that's a really good point.
Thank you. I have a motion to accept the declaration of disaster emergency extension.
I'll second.
Oh, I'm sorry, yes, you did. Yep,
Great.
second. All in favor, say aye.
Aye.
Aye. So carried, thank you.
5.4, recommend award for ITB for food products. Director McDermott.
Commissioners seeking your approval for awarding food products to ITB, multiple lines. I don't have a copy.
It'd be Cisco, Feasters, and Kiko.
Okay. Motion to accept.
I'll move.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
5.5, vote on license agreement with Dino Edwards.
Commissioners seeking your approval on this license agreement with Dino Edwards. This is for the Hesker Hill Tower site access, $1,500 a year annually for 20 years.
Okay. Any
Part of the
discussion?
new radio project.
Yes. Any discussion on this? Hearing none, I have a motion to accept.
I'll move.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
5.6, vote on amendment to lease agreement with McMorris Family Trust.
Commissioners, seeking your approval on the amendment to the lease agreement. We're looking to extend the term of the lease for another 20 years for the Bald Eagle Tower site, and that's at $500 annually. Again, you'll see multiple of these coming through as the radio project proceeds.
Mhm.
All right, and this is going to help us extend radio coverage in Lycoming County, especially for our
It's going
first.
to vastly improve radio coverage throughout the county.
Right, especially with our first responders, so that's good.
I have a motion to accept.
So moved.
I'll second.
All in favor, say aye.
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 5.7, recommend award RFP for engineering and surveying services.
Commissioners, we're seeking approval to award Pencor Consulting engineering and survey services for the Hughesville Water Authority Tower site in the amount of $109,880. Again, this is part of the radio project. And it's one of the engineers that was selected by MCM in the RFP.
Okay. Jeff?
I'd just like to add that price also includes the Hesker Hill site. It is both sites for that price. And they were the low bidder that met they did meet all of the RFP. They were vetted by our consulting group. And I'd also like to say they are a company from in the county. They are local to Lycoming County.
Okay. Any further discussion or questions? Hearing none, can I have a motion?
So moved.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
5.8, recommend award RFP for professional consulting
Can I ask one question?
Yeah.
Mr. Hutchins, is that to build the site,
No.
or is that to do the consulting and engineering?
That's the engineering and survey. The towers require some very specific core borings, so we know what steel to order and everything.
Okay.
So this is going to be the site, the design, all the permitting and everything.
Okay, and
And
then we'll see a subsequent RFP.
We'll see an RFP for the tower steel,
Right.
and then we'll see an RFP for the actual build out of the sites.
Okay.
Yeah, that'd be
Yeah,
a
and that
good
was
deal
all.
if we could get everything like that for that price.
Yeah,
Well,
we,
but it won't be, yeah, that's just the engineering.
Yeah.
we actually we received 13 bids.
Why aren't we bundling them?
That's a good question.
We almost need one before we can move to the next one, but I understand what you're saying.
Yeah.
We did receive 13 bids, and our consultant said that's unheard of. They've never seen that many bids arrive. So, I mean, people are looking for work.
Okay.
Good point. Okay.
Or 5.8, recommend award RFP for professional consulting engineering services to Century Engineering.
Yes, Commissioners, seeking your approval to award the RFP to Century Engineering. This was briefed by Planning Department. Century Engineering would be the primary engineer, and Larson Design is the backup strictly for the Planning Commission.
Okay, any questions?
Yeah, and this is on an as-needed basis.
As needed
Yeah.
basis, if you recall,
Right,
I believe the total amount last year was below $20,000 in utilization.
right. And these are actually usually paid by the applicant when
Correct.
they're
It's all paid
reviewed
by
by reviewed by the planning commission engineer. Okay.
Okay, motion accepts.
I move to approve.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
5.9, vote on Pennsylvania Commission on Crime and Delinquency Subgrant.
Commissioners, we're just seeking approval to submit the subgrant award letter from PCCD for supplemental funding in the amount of $87,771. $87,771. Something like that.
We're attempting to get that from PCCD, right? We're not spending it, as
No,
you said.
We got it.
We got it and we're
approving
accepting
the
it, right?
acceptance.
Yeah, the grant, okay.
Yep. A motion accept.
So moved.
I'll second.
All in favor, say aye.
Aye.
So carried.
And 5.10, vote on amendment to professional and administrative services agreement, SEDACOG.
Seeking your approval on an amendment with our administrative services agreement with CEDACOG for the CARES Community Relief Block Grant. I'm trying to figure out exactly what we. So it changes some specific CFR Part 200 language, which I'm sure is pushed down through the government. Removes a requirement to receive prior written approval from DCED before the county executes or concurs in any subcontract with any person or entity.
This is the subrecipient change that DCD
Yes.
made, that basically said, okay, if we give money to Camp Susk,
We need to include this amended language based on the language that
Right.
was pushed out from the.
right, I just pulled them out as an example.
Yeah.
Yeah.
Yeah. A
I have a
motion-
feeling we may see more of these as the
Yeah.
federal regulations and state
It's changing.
Can you
changes.
change? Yeah, absolutely. A motion accept.
I'll move to accept.
I'll second.
All in favor, say aye.
Aye.
Aye, so carried.
Commissioner comment?
Yeah, just quickly, I know that we spearheaded an effort to cut the 2020 budget. And we do not have any of the totals back yet, but we've cut a significant amount of the 2020 budget. which will help out on the fund balance for 2021. We still have a long way to go, but we will get there.
So the only thing I'd like to say in that regard is I think it's important for us to recognize that, like with any budget, you have to correct the structural problems years ahead. In other words, it's great that we have managed to cut the 2020 budget and that money will roll over, but at the end of and by the way, that the director, McDermott, has been spearheading that, and it's done a good job of finding places where people essentially over budgeted or they weren't able to do projects. But I think that we need to be cognizant.
The impacts of COVID
And the
not
impacts
being
of
able to do certain things.
Right, impacts of COVID and other things. But I think we have to be cognizant of the fact that 2021 will be staring us in the face. We will have already gotten the low-hanging fruit from 2020, and we'll have, and I know my colleagues are aware of that, and I just think it's important for us to point that out, especially to the employees and members of the community. So that the best time to always correct. If you look, I was always amazed by this. One year IBM had this incredibly good year, and they were cutting 10,000 employees. The CEO said, look, we have to fix our budgets when we're fiscally strong. And that has stuck in my brain ever since. And so to a certain extent, we have a certain amount of fiscal strength right now. We need to work on cutting that budget now so that in 2021 we don't have to end facing a tax increase.
Back to the COVID issue, we were talking a few minutes ago about the deaths and everything going on. I just want to give some stats here. The COVID survival rate, 0 to 19 years of age, the survival rate is 99.997. So 3/1000th of a percentage do not survive if you're 0 to 19 years. 20 to 49 years, 99.98% of people survive. 50 to 69 years, 99.5% of people survive. In 70 plus years, 94.6 people that acquire this survive. Again, this is serious, but in most cases, it's not lethal unless you have other health issues. And are we doing the right things to a generation of children for 3/1000ths of a percentage? I've talked to a lot of parents this past week, and their kids are home 3 days a week and learning 2 days a week, and the kids are having meltdowns. The parents are trying to help them from work because the kids are calling them, says like, Dad, Mom, I can't learn this way. I have to be in school. This is too difficult to learn this way. Good students. I know one that was an A student and right now is struggling and the mother's afraid that he's going to fail. And he's getting frustrated and he's starting to act out. So as we see the survival rate of 99.997 of kids from 0 to 19, we have to reevaluate this and figure out a different way that these kids can be in school 5 days a week. Because it's affecting an entire generation of kids, incredibly. And these stats are from the CDC. Thank you.
So the only thing I think, we can view COVID as obviously nobody's happy with it, but it's also an incredible opportunity for us as a nation, as a community, as a family to grow and to say, hey, I just go back to our parents and I'm reading about the bombing of London the other day and just every night relentless bombing. Forget about being trapped at home. You're trapped at home, and you're in a bomb shelter, and you've got bombs going off all around you, and your community's being destroyed. I mean, we have to look at how we as a nation are so far behind the rest of the world. Taiwan, China, other countries cut the number of cases, got their economies back open, but they did it because they put the importance of the community above the individual. And we traditionally have always put the individual above the community. We need to maybe rebalance our thinking and put the importance of the community above the importance of us as individuals, and say, yeah, we have to sacrifice some of our individual desires. Because look at the number of cases in Taiwan is absolutely astonishing. I mean, we are 5% of the world's population. We have 200,000 deaths out of, I think, 3 million worldwide.
Yes.
So we are looking at being a whole lot of
I
percent.
think the stats should have went from 70 to 80, 80 to 90, 90 to 100.
The what?
You know.
Anyway, I just think that we don't want to, I understand how difficult it is. We don't want to rush. And then I think that some of the cases we're seeing increasing in some of our rural communities is a result of that. So, but we'll keep plugging away. We'll keep our spirits up, and we will keep our masks on. And just remember that all the things that our parents, all those veterans did for us, and we can do something, right, to pass on to our children.
Okay.
Very good.
Public comment at this time.
Gotta get you.
Can you remind another 3 minutes?
And please state your name for the record, and please limit your comments to 3 minutes.
John Sharman, Jersey Shore. I'm asking for maybe a little bit more than 3 minutes because I have something to read today.
Okay.
There's been a lot of pushback by Republican politicians in the area concerning Governor Wolf's veto of people being allowed to go to sports events, and that with most every Republican politician had some kind of comment in the Sun Gazette about it. But I do find it's very, very telling that no Republican politician in the district within Lycoming County has said much about shop vac at all in the impact that it has on the area. I would like to take and read from my phone an article that appears on WHYY out of Philadelphia. Shop vac is a brand that is to wet dry vacuums what Kleenex is to tissues. But anyways, in the termination letter, I'm sorry, this is going off again. I'll shorten it up to this. Okay, there were names in the article. The firm that wanted to buy Shop Vac, and also with JPM Morgan was in it. Well, they found out in the end, trying to sell Shop Vac, that it was more profitable to liquidate it. JP&M's the one that backed out of it. They just didn't walk away from this. They didn't walk away from this at all. And it has affected 425 employees altogether throughout the county with it. Some have found jobs, some haven't with it. I can't believe that this information wasn't known a long time ago. There's a partial article in the Sun Gazette, but I do. Rick, would you read this, please?
You having trouble reading it?
Yeah, I'm a little nervous about this, okay?
All right.
I don't read
I mean,
well. Can you please read that for me?
Yeah.
I'll sit down.
Shop Vac Corp., a brand that is to wet dry vacuums what Kleenex is to tissues or Band-Aid is to adhesive bandages, is shutting its doors after 53 years. Based in Williamsport, Pennsylvania, the company began laying off its staff of 427 on September 15th. In termination letters, the company blamed COVID-19 and a buyer who, quote, without warning, walked away from the deal, close quote. Those familiar with Shop Vac's finances say the pandemic is being used to justify the rapid liquidation of a company that employed some workers for decades. Quote, it wasn't because of COVID, said Candace Gare, 36, who worked as a treasury associate with the company for 5 years, which involved tracking payments and invoices. During the pandemic, orders increased, and, quote, we had the best sales in years, close quote, she said. Instead, Gare and others say the closure is a result of long-term financial troubles, and that rather than give warning, the company is hanging employees out to dry without health care notice or severance pay during a recession and a global pandemic. And then there's a couple of pictures of employees there, which actually I hadn't known, with signs. While other businesses shut down in March and April, the state classified ShopVac's manufacturing facility and warehouses in Williamsport as essential, allowing the company to continue operating. Now the layoffs will contribute to the already bleak economic picture in Pennsylvania, which experienced record high unemployment earlier this year. ShopVac was the 11th largest employer in Lycoming County at the beginning of 2020. The most recent state data available puts the unemployment rate in the county above 13%. On Monday, Gare organized workers who have already been laid off and those winding down plant operations to protest in front of the Reach Road facility. Dozens filtered through during the day carrying signs and slogans like "No notice" and, quote, "Work during COVID, now no job." Quote, "This is a nightmare," said Tia Fisher, 48, a customer service representative whose layoff took effect September 18th. Quote, "You walk in one day and they give you papers and say you're done," close quote. Unexpectedly, losing health care benefits and a job also put many workers in a bad position. Quote, "I have 3 boys. I'm a single mom," said Fisher. "That was hard, telling my boys I lost my job." We knew things were bad. ShopVac was at one time emblematic of Pennsylvania's local manufacturing tradition. The Miller family founded ShopVac in Williamsport in 1953. Production facilities eventually spread to Binghamton, New York, as well as Canada, Vietnam, and China. 4 people inside and outside the company who were familiar with ShopVac's finances asked not to be named, either because they were not authorized to speak about the matter publicly or due to fears it would hurt their ability to find work in the future. Their stories all align around a sequence of events that resemble a slow decline, not a pandemic-induced tailspin. ShopVac extended itself by opening facilities in Asia in an attempt to bring down its production costs. Those moves were expensive, however, and the company wound up deeply in debt. Before the coronavirus pandemic gripped the globe, the company was looking for a buyer with the understanding that operations would continue. Quote, "We knew that things were bad. We could see it," said Fisher, of how the regular workforce perceived the company's financial picture. Demand picked up during the pandemic, boosting morale, but the revenue wasn't enough to offset the debt. KPS Capital Partners, a private equity firm based in New York, made an offer to buy the company. An offer ShopVac's bank, J.P. Morgan, rejected. Quote, "I think someone in the room looked in the numbers and realized that they could make more from liquidating the company," said one person familiar with the company's finances. KPS and J.P. Morgan both declined to comment for this story. No one answered the phone at ShopVac's Reach Road facility, and messages and emails sent to the company's human resource staff were not returned. In official documents, representatives of the company gave other reasons for the abrupt closure. Quote, "We regret that we were unable to provide you with more notice. The current global pandemic and economic crisis has left the company in dire financial conditions," wrote Allison Letta, Director of Human Resources and Payroll, in termination letters to employees. Quote, "We fully anticipated the sale to be completed and for the buyer to hire all employees. This unforeseeable business circumstance has left us with no choice but to close our facilities," close quote. In a mandatory closure notice provided to the Pennsylvania Department of Labor and Industry, Letta wrote that all 3 facilities in Williamsport would be closing and that the, quote, "wind-down period would continue through November 13th. It did not say what would happen to ShopVac's overseas entities. Some employees also questioned whether ShopVac violated the Federal Worker Adjustment and Retraining Notification Act, known as WARN, which requires that companies with 100 or more employees provide 60 days notice before plant closures or mass layoffs. The exception to the 60-day rule are, quote, "faltering company, unforeseeable business circumstances, and natural disaster." Workers like Fisher said at a minimum they expected more transparency from a company that had been a long-standing part of the community. Quote, "They left us in the dark for so long. They looked at us like we were just peons," she said. "What I hope to get out of this is for them to realize they hurt so many people." Well, you know what, John? I'm glad you brought that to our attention. The only thing I can tell you is this. These commissioners are deeply concerned about it, and we are trying to do something. We can't say more than that at this time, but we are trying to do something.
Sometimes public perception is more.
Right. Okay, thank you, John. Any other public comments?
Yeah, I have a few, just a couple, Scott.
Thank you, Rick.
Good morning, Commissioner.
Morning.
Good morning to the people still in the hall. My name is Bill Fenderson from Linden. You know, I do appreciate the idea that we did get a treasury report. I thought it was very nice to hear. I thought that was a movement in the right direction. But you know, I
I cringed to think about something here. When I got an email last night from one of the fellows I work with, used to work with, and that, and he got me a website to look at. And one of these things that bothers me about the way they're, and I don't want to go on about Covert too much because it's a major mess. But why is it that we took 2 months into 3 months to get the colleges to take a look at this? Why wouldn't they report it earlier? Why would they do something sooner? But rather than wait till after the fact. And we know probably there's a lot more going on we don't know about. And we never will. We'll let that alone because that's another problem to solve. My question is, are you aware of what happened down in Muncie the other night?
Regarding what, sir?
Revolving to a fellow getting shoved to the ground?
Yes, I heard about it. Unfortunately, it's very sad.
And it's sad that we're turning into a problem here that no one has a handle on.
Yeah.
And it just amazes me that we continue to go on this path in a bad direction.
What he's referring to, if you excuse me for a second, what he's referring to is there was a gentleman that didn't have a mask on, and he was an older gentleman, and a younger gentleman proceeded to be upset with him because he didn't have a mask on and shoved him to the ground. Go ahead.
And at that time, I see that there was a police report filed on that. But, it's sort of strange we have to go down this route. There's so much friction going on right now with everybody. It's ungodly. But being that said, and I know going back about 7 weeks ago, one of the commissioners made a statement they would not enforce the use of masks in Lycoming County. I think maybe we should reevaluate this a little bit and understand what it does mean. And what you was given the prognosis of all these different areas about the covert, I don't want to dwell on this, but it shows you when you go into the PA.gov website exactly what pertains in all this stuff. It shows you all the conditions that people have and how the severity of it is worse than what people understand. So we're lucky we don't have a lot of people in the hospital, but we're still getting people sick. We have protests. I could care less about protests. I have no time for them. But we get large groups outside taking photographs and posting them on the websites. Everyone's all together, tight together, with no mask on. And you would think that someone would take hold of this and say, hey, let's do it the right way. So, and again, let's do it the right way. But with that being said, we'll go back to jobs. It only takes one plant to close, and then we throw the red flag up. What are we going to do? Is there a future in Lycoming County? Can we get new businesses coming to Lycoming County? If you look at Hazleton, Wilkes-Barre, State College, and wherever, they're getting the majority of all the large corporations coming to their area. We can't get anything here. We got the infrastructure. We got an airport, which could go either direction right now. We got the rails, we got the interstate, we have everything right here. We can't get any good paying jobs in this area. Has the Planning Commission actually looked at getting some new new factories coming to the area? And I'm not talking about hotels. We don't need any more hotels. Hotels don't pay squat. We need to have business. No matter how you look at it, you need to have business. So, can you reply to that about getting more business in this area?
Yes, Bill, there's some things that are on the horizon that are very promising, and we can't elaborate them on at this time, but there are some things that are out there that are very exciting and promising, and hopefully we'll know within the next month whether they materialize.
Would it be using the store frontages now that are vacant?
I don't want to elaborate on it.
No, this just a
Yeah.
question.
Yeah.
This is just,
These would be good paying jobs.
okay.
Yeah.
Well, that's finally some good news to hear. And I have to commend them for hearing that kind of news coming to this area, because we definitely need some sort of help. Because as you said, with everything that's going on here, your budget crunch, and I know all about budget crunches, it's tough. you have to make some serious decisions what you want to do. Without a lot of new industry coming to town, we're in trouble.
So the only thing I can say is, you know, Geisinger's construction of a new facility is extremely important because they are not paying off old debt, you know, that may have been accumulated, as was with the case some of the other health systems in the area. They are expanding and they're going to hire. Obviously, UPMC has expanded also tremendously and has hired. And healthcare is, in central Pennsylvania, healthcare is one of the top employers, you know, for new jobs. So that's a good thing. I think that what we have to do is, our families have to do, is get our kids ready for the workforce. I mean, it's a two-way street. We want employers to come here, but employers have to be able to look at the metrics of a community and understand that kids are getting an education, that kids are learning soft skills. You know, and they can't necessarily learn all of it at school, Bill. I mean, I know you know that. They've got to learn it at home. It's got to be, every day has to be a learning experience for our kids with our parents and or whomever it is, whoever's raising them, our guardians. You know, we have to try to do that if we want to move this community forward.
Do you recall, I don't know if you guys recall this.
Bill, excuse me, I do have to leave, and I don't mean to be disrespectful, but.
That's fine. Go ahead. But the one quick, and another one here, if I may have the time here.
One more minute, please.
Okay. You want to go back in time when Penn Tech used to be a different organization. And I was involved with that group. At that time, they were teaching the kids trades, and they put you out in the workforce for 6 months after you did your schooling for 6 months. That has disintegrated. It don't happen anymore. Why is that? Why don't they train better and let them work in the environment?
Bill, we have two outstanding colleges. Penn College has, let me finish.
Go ahead.
Penn College has a world-renowned culinary arts.
Yes.
They have a world-renowned
Yes.
now plastics department.
Yes.
Their welding department is second to none.
Yes.
And they employ people. Those students, there's 100% placement in many of those fields. They have a fantastic nursing program.
Yeah, well,
I would ask you to please educate yourself on Penn College. I've been up there. Excuse me, I'm speaking. You asked me a question. I'm
Okay.
answering it. I'd ask you to educate yourself on that college and their placement. How much of a percentage of place? The problem is those students who are skilled laborers. They're outstanding students because there's companies grabbing them up and they're going elsewhere. That's the problem right now. We need to make sure we get the employer here so those students do not leave, or they decide to stay here, and we can do that. But they have outstanding placement percentage.
So can I just jump in on something, Bill? I think that what Bill is referring to and what is lacking is a community college. At one time, Penn College was a community college, Williamsport Area Community
I
College.
went to body shop in 66 through 68.
Yeah, and so part of our problem is that we have a skill gap where we have folks who get out of high school, or, and this is not just getting out of high school, they may be in mid-age, and look at the shop vac workers. We had a 36-year-old we read about in that article, a 48-year-old. I mean, these people have a long time left in their work. Bill, I didn't mean to interrupt you. But the skill gap, and there are community colleges in Luzerne. There's one that's been trying to, I think is doing something in Watsontown, and there's another one. And I think, quite frankly, we as commissioners need to look at supporting those institutions because there is a gap in the skill set that someone who can't afford to go to Penn College or who doesn't necessarily want to commit to a degree. But, you know, I think it's something we need to think about.
Maybe I understand what you're saying. I'm quite educated in this field. Okay, I'm talking about high school, not college.
Right. Okay.
I think we're on different paths right here.
Right.
They did away with that because
Many of the high schools offer college credits, and they go up to Penn College to learn things.
No. Being able to work in the field.
Mm-hmm.
Okay, I spent my time going through high school at the tech program.
Mm-hmm.
I was offered a job down the Philadelphia Inquirer to work as a pressman down there, which I was trained in. My wife didn't want to leave the area. I kicked myself in the ass for not going because it was great pay. Okay, that's what I'm referring to. not colleges. I'm referring to getting the kids hands-on. You take the vocational students down outside Watsontown down there, they have a program for high school kids to go out and work in the industry, not in Williamsport. But that's enough for that. And I know it's not
But just so
trying.
you know, Bill, that's not entirely true. The high school,
Yes, there's several high
there
schools that do.
but it's not as extensive as maybe when you were a kid. But the tech programs that the high school has,
Yeah,
kids can go, and in fact, they can be in high school
yeah.
and go. But I understand what you're saying, and I think that it is part of the reason that our workforce, we have some folks who have very little skills, and then we have other folks who have really high skills.
Yeah.
And we need to help the folks who don't have a lot of skill sets find an economical way to increase their skill set. And maybe that's what you're talking about, I'm not sure.
No,
You're not? Okay.
it's
well,
not my
then-
fault. You guys are too young to understand all this stuff.
Heck, we're not that young.
I really don't want to go into this.
Thank you for
anymore
calling me
because-
young.
Yeah, you're young. I'm 71 years old.
Okay.
I've been through the ropes.
Well,
I
then-
know what was out there. I've been through the whole thing. He's been through the whole thing.
Mr. Metzger, I didn't take 3 minutes, could I just add maybe 1 minute to what
Yes,
Bill said?
step up 1
please?
minute, please, then we're gonna
Okay.
wind up the meeting.
I was on the school board for a couple of years in Jersey Shore. When Bill and I went to school, Williamsport Area Community College, whatever you want to call it back then, they had one vocational program for many different trades. They took everybody in from throughout the county, and that is what is lacking today. And it's driven up, this is one reason it's driven up part of this educational cost, because every school district has to do their own VOTEC program. It used to be centralized where Williamsport Area Community College is now, or Penn College. What was known, when I went there in 66 through 68, was the Williamsport,
It was classified tech.
Williamsport Technical Institute. And this is what Bill means. I see too much when I was on the school board of emphasizing too much college and not enough with the trades for plumbing, electrical. That's what Bill thinks, and that is what some of the schools are trying to do, but they can't do it. It should be a central localized program to bring in all students from every county. That way, it takes away from some of the operational expenses of the schools.
Okay, thank you. Okay,
I'll talk with you guys afterwards, because I want to talk to you about the tech program.
okay, thank you for attending, and we've completed the meeting, and our next meeting will be on Tuesday, October 6th at 10 a.m. right here in this meeting, or room, I should say, meeting room. Thank you. Have a good day.
John, which school did